Oh, for crying out loud.
Oh, good. I'm for 7 minutes now.
Oh, we're live. Oh, good. Oh, all right. Hi, everybody. I'm still learning this technology. Um, I don't know. I'll get it, but I didn't realize I was live already. So anyway, welcome today, and little different take today than we've had the rest of the week. And I hope you look back at some of the videos that we've already done this week where Sarah Tergender, that trains health professionals, was on Monday, and Danae Tate was on Tuesday and Wednesday talking about transitioning your lifestyle. And yesterday we had an awesome testimonial about the gene SNP testing that we have. So today's the end of the week, and we're going to do it again next week, starting on Monday. And again, another 10 minutes a day on coming out of quarantine, building your immunity, and decreasing stress. So we've got some great speakers next week. We've got a naturopathic doctor talking about immunity. We have a mental health nurse talking about some of the stress things. We've got a personal trainer talking about fitness and showing some things, fitness at home, as well as supplementation that will, I'm looking at my wrong thing here, some of the physical and mental benefits that people have actually seen from being in quarantine. So that's coming up next week. And there is a business behind this. So if anybody's interested in extra income, we're really a great team. It's great to hang out with some positive people and help people feel better and make a decent income at the same time. So today's Kerry Koss, dental hygienist. She works for she works in Battle Creek. And remind me again the name of your practice where you work.
It's Natural View Dentistry.
Naturally You Dentistry. Okay, in Battle Creek, Michigan. All right. So, okay, Kerry, go ahead and give us a few thoughts.
First, I wanted to talk about the new normal. So, really, I think that dental hygiene and dentistry is essential. But I know a lot of people, even hygienists, feel it's very dangerous, or you know, it's iffy to start up now. But hopefully that will be starting soon. I want to get back to work, but I've been watching a lot of things, and they're talking about really having emergencies or urgent patients being seen first. And really urgent is, so it's been a while, and there's some people that if they had cavities and we wanted them to come in, you know, within a month, well, it could have been that long already. So those are the first people that the doctor will see. And then I think for hygienists, anyone that has gum disease, periodontal disease, that those people should be seen immediately. So they're probably going to be doing it a little bit differently, over the phone, making an appointment, see if you have any symptoms at all. The waiting room will be the car. And so then once you can come in, probably you'll have your temperature taken, and then sanitize their hands. And, you know, obviously once they're in the chair, they can't wear a mask, but I'm sure we'll be donned out with N95 masks, and even gowns and maybe booties. So that is something that it's going to be a lot different for a while, I think. Appointments are going to be longer, but I think that it's important to get that back up and running. And so in the
Absolutely.
meantime, at home, continue your oral hygiene, like brushing twice a day for 2 minutes. 2 minutes is really the key. Um, I think a lot of people, don't brush for that long at all.
I
Um,
didn't know it was 2 minutes. I had no idea that it was supposed to be 2 minutes. That's a long time.
yeah, well, 2 minutes.
Yeah. Does it matter if it's an electric toothbrush or a hand one that you're doing?
I
Have you
mean,
heard any difference?
I think that a manual toothbrush can do a good job just as well as an electric one, but those are helpful because a lot of them have a timer, and then they also have like 30-second intervals with them, so that really you should brush in a pattern. So I know a lot of time if you're walking around the house and doing something, you're not paying attention to,
Mhm.
you don't know where you brushed or anything. The electric ones are also good for people that have recession, so you can't brush too hard with the electric toothbrush. Um, but it's just, preference too. I think dexterity too. Older people, electronic toothbrushes are good. Um, but also flossing, and um, I know I just wanted to add in there, like I've heard people that they have something stuck in their tooth and they just grab anything to try and get it out. Well, that's not a good idea, because you can like cause an infection, a whole systemic infection. Um, so a water pick or like an air flosser is good.
Mhm.
Like I'm thinking basically popcorn. Like people come in for emergencies with popcorn hulls stuck. It's like wrapped
I've
with them.
never gone in, but I've had that happen. Yes.
Very common. So, and then I know a lot of people have little instruments and they try and clean their own teeth at home. So, just be careful. It's not a great idea. Um, and so good oral hygiene, that's, important right now. And then also wanted to get into the vitamins and minerals that are good for your teeth and your gums, which everyone knows. I think calcium comes to mind. um, and then vitamin C. Vitamin C is great for the gums, and um, so I just looked up other ones just to make sure and get down to what the main ones are. And so calcium, uh, vitamin D, and phosphorus, and vitamin K all support your bones. And then vitamin K is good to take with vitamin D. I think that the best source of vitamin D is the sunshine.
Mhm.
But I live in Michigan, and that's not a great source right now. Another one for the gums is vitamin A, and and then potassium is also good for bone mineral density, and
Right.
and they all kind of work together too. So
That's right.
I think right now for your immunity, everyone should be taking vitamin D, vitamin C, vitamin A, um, and and you know it's also good for the gums and the teeth.
Right. Well, and then having what you mentioned, vitamin K, and I always like to make sure people know that there's K1 and K2, and K1 has to do with clotting mechanisms, but it's K2 really doesn't have anything to do with the clotting mechanisms, but it does have to do with the uptake of your minerals and increasing your immunity. So in order to build your bones density um, in general, then you really need to have your vitamin D levels checked to see what they are. When we get back to the doctor's offices again, that should be a routine, that you know what your vitamin D is. I know the naturopathic doctor that we're having on next week is, she's going to be talking about immune supplements, but she's been having really great success with people that have come in with bone issues. And She's found that the blood levels need to be between 70 and 90, which normally you think more in the 30-40 range, but she's found 70 to 90 helps change that situation quite well for many people. So, having that vitamin D, especially in Michigan and the northern climes, is really important because you don't get it in the wintertime, like you were saying. And then all of those things work together. The calcium, you have to have the magnesium, the boron, the manganese, all of those things that help the calcium get in. And with the situation with our supplements right now, a lot of them don't absorb well. They're, if you're taking a Centrum Silver, chances are your body's not breaking it down. And you don't notice a difference when you're taking a Centrum Silver. Now, the supplements that we have are isotonic, and so they absorb. They're super absorbable into your system right away. So even people with gastric problems or dental problems that are eating, they can actually benefit from these supplements much more than the over-the-counter type nutrients that you would buy at your local drugstore or Walmart or some of these places. So be careful with the supplementation and the way our food is right now. It doesn't have the nutrition that it used to have. On the top of this page, you'll see a little chart of where things were on the top of my Facebook page. So look at that, Health Leaders Comment LLC, and you'll see that difference. And that's really important for that bone health, right, Kerry?
That's right.
Yeah. So anyway, our time is up. We're at 11:12 already. I think we got on a little bit late, but please come and see us next week. And I hope you're enjoying this, and leave some comments, if you will, on how we're doing with this. I get a lot of likes and hearts, but I haven't seen a lot of individual comments. I'd like to know if you'd like to hear from other health practitioners and what kind of information you'd like to hear about. We can talk about just about anything. So, but next week is all scheduled. I'm not sure what I'm doing after that. We'll just see how things go. This was kind of a trial with me and learning things. So anyway, have a good weekend, everybody, and we'll see you Monday, I hope. All right, thanks, Kerry. I appreciate it so much.
Yep. Have a good day.
Yeah, bye-bye.